Welcome back, everyone. I'm pleased to welcome our next keynote speaker, Dr. Nancy Poole. Dr. Poole is the director of the Center for Excellence for Women's Health, a research and knowledge exchange center hosted by BC Women's Hospital and Health Center in Vancouver. In that role, she leads network development, research, and knowledge exchange related to improving policy and service prevention on gender and women's health. She has worked with governments, organizations, and groups across Canada and internationally, offering creative thinking on complex issues such as the interconnections between substance use problems and the experience of trauma and intimate partner violence. Dedicated to connecting across distance, cultures, genders, and sectors, Nancy is a catalyst for bringing knowledge to practice and policy to make social change. Dr. Poole will be sharing her knowledge around trauma, violence, gender, and substance use, working toward equity and resilience. And again, in this session, we'll have some time for questions at the end. I invite you to share any questions in the question and answer section, which is beside the chat section on the right side of your video. So please feel free to pop those in the chat as anything comes up. Over to you, Nancy.
Great, it's good to be here. So really happy to have the chance to talk about these issues with you today. Sorry, my screen is doing some funny things here. There, just wanted to start with a land acknowledgement that I acknowledge with respect that I'm calling in today from the traditional, unceded, ancestral territory of the Lekwungen speaking peoples and the Songhees and Esquimalt peoples whose historical relationships with the land continue to this day. So as Wendy said, I have been working for a long time on all these issues, starting with back in the 70s, working in Toronto and being a part of starting some of the first violence against women services. And then working in multiple provinces, 4 now, I guess, on substance use issues as a counselor, as a program consultant, a researcher, a book editor, and a network builder. And in my personal and professional life, have really tried to walk with Indigenous women to bring forth their perspectives in all this work. I'm going to talk a bit today about the trauma-informed practice, part of my work with the Justice Institute of BC and governments and organizations across Canada and internationally, about the importance of working at client and system levels on advancing trauma-informed approaches. And, really thinking lots about, as a researcher over 25 years, and now as director of the Center of Excellence for Women's Health, about these closing the loop between research and practice and advancing our expertise on sex, gender, and equity-based analysis. So really hoping that you enjoy this little walk with me today. Going to start just back in the era of consciousness raising to begin the conversation about solidarity and resilience and equity. Then I'm going to talk about one of the projects that we've been working on recently about integrating practice on violence, trauma, and substance use. And then look at some of these common approaches in this picture here as a basis for our collaboration and resilience and solidarity across our fields, and seeing trauma-informed as a key uniting paradigm. And then conclude with this idea of lifting each other up. So, the consciousness raising part was something we did in the 70s, where we shared our experiences as women and made connections across really diverse experience So we synthesized this collective discussion in small groups that we did to form new understandings of our experience. And that was when we started to think about how violence against women was a really important piece that united us and that we needed to act on together. And so, I think it's important that as through consciousness raising and other dialogic and activist mechanisms, that we were able to disrupt some ignorance about women's lives and women's health. And, Dr. Nancy Poole really mentioned one thing that I think is really relevant to us today that emerged out of that movement, that we needed not only to generate knowledge together, but we needed to understand how to identify, critique, and transform ignorance. So lots to think about as building from that. So this project that we did recently with funding from the Canadian Institutes for Health Research, we did in collaboration with the Canadian Centre on Substance Use, the Justice Institute of BC, and Women's Shelters Canada. And we tried to synthesize the research evidence that linked COVID-19, intimate partner violence amongst women, and the substance use connections. And we found all kinds of really interesting things. And this is, a kind of a picture of what we found around the links between IPV and the pandemic. It's quite a neat graphic that describes all the ways in which these linkages are there and become corollary epidemics. This is from the Center for Global Development. And I'm happy to share my slides later if people want to follow down some of these paths that I have on the slides. But the other thing we did was to look at how the increases in substance use and the increases in IPV were connected in the context of COVID-19 times, and to really go back to thinking again about how they're connected overall. And this was one of the things we found from Dr. Carol Warshaw from the National Center on Domestic Violence, Trauma, and Mental Health in the US, which really talks about, how these substance use and IPV can really be connected in very unfortunate ways. But really important for us to see that responses can be survival strategies, and, quote, symptoms may be responses to ongoing danger and coercive control. So thinking about IPV and COVID, thinking about IPV and substance use, and then going back to our early work that some of you, I was just talking to Wendy and Kate about, of work we did years ago at BC Women's Hospital, and thinking through these connections of how central trauma can be to substance use problems, mental ill health, and violence against women concerns, and how they're all linked to these social and structural determinants of health. So to come back to that recent project, we came back again to that idea of trauma as central, and with the idea that if substance use and IPV are multi-directional and complex, and they're both linked to psychosocial factors, that we really need to be able to talk about this together, and to see how trauma can be a uniting paradigm for our work in all these areas. And so we summed it up by saying, if the relationship is there between these two issues, we need to make the service provision bidirectional as well. We need to think about, how can we address substance use amongst those who are experiencing intimate partner violence, and how intimate partner violence related issues can be addressed with women who are accessing substance use services. So really important to come back to this idea again that these things go together. We can figure out how to respond in an integrated way. And we found some great things were happening when we looked at, so what are people doing? We saw some really interesting work from Wellness Together Canada and other places that are really taking this idea of mental wellness forward, and really offering mental health supports in all new ways. And the next slide, I'll talk a bit more about that. And those of you in the violence field have done some amazing work in the context of COVID around safety planning and responding to disclosures, et cetera. And lots of them by the Learning Network from Western, but many others of you as well. For those of us in the substance use field, have really spent some time thinking about how do we have these collaborative conversations about multiple substances at once and multiple issues, including violence at once, and have been working away with people in the anti-violence field, as well as midwives, as well as sexual health clinic people, many Indigenous providers, et cetera. And what do those conversations look like? And finally, we did see a few things around how to do these deeper integrated approaches around trauma-informed, equity-oriented approaches to support on both issues. And again, from Carol Warshaw and others from that national center in the US. But just before I go on, I just wanted to give a shout out to the folks in Canada who've been putting together this website called Wellness Together Canada, where people can go to learn, to practice skills, to connect with peers, to actually do some self-assessments and thinking about their health themselves, and if they wish, get in touch with a counselor. So really interesting how this moment in time has really pushed us along in this understanding of how we need to work more accessibly with more access for people in these times. And it's shifting the balance, I think, towards much more readily available support for women. So we made an infographic at the end of this project with CCSA, the JIBC, and Women's Shelters Canada. That's pictured here, and I think you were going to put the link in as well, I think, into the chat if people wanted to download this, because we attempted here at the bottom of this about linking practices to really show some of the things that we saw that might help the violence field think about how to talk about substance use, and how the substance use field might access great information that you've developed in the violence field around making safety plans, etc. So we put these together with some quick links to get people thinking about how doable this is and how much we can act together. But more importantly, in the center of that infographic, we wrote down some of the things we saw when we looked at all those types of interventions, and we saw some common principles for practice and policy from the violence field and the substance use field. And these were around empowering, gender-informed, trauma-informed, harm-reducing, equity-oriented, culturally safe, etc. And, that involved thinking critically about gender equity, safety, readiness, strengths, skills, reducing stigma, addressing determinants of health, linking the issues, promoting health and preventing harm, making space for addressing both, etc. So we saw so many hopeful things as we started to look deeply at what's going on in substance use, what's going on in anti-violence work, and how those might be linked up. So I'm going to take you on a quick tour through a few of the substance use field approaches that bring in these principles and practices, just to invite you to think more positively about those of us in the substance use field, because oftentimes there's some old-fashioned ways of thinking about us as being pretty unidimensionally about 12-step. And I just wanted to bring you into how we're still doing 12-step and lots more as well. So on the gender-informed side, this is a poster from the University of Saskatchewan and the Saskatchewan Prevention Institute for young women entering college, and that really helps them critique the alcohol industry for its sexist and exploitative and coercive ways, and gets women thinking about, you may be able to read this on the bottom, I don't know how big your screen is, but it says, we know our yoga poses and we know how to live gluten-free, but we just need to count our drinks. So starting to do health promotion around drinking in much more modern ways. And this is a program in Winnipeg called Project Choices that has a really strong evidence base that is about inviting girls to think about using effective birth control, reducing drinking, or both in an effort to prevent alcohol-exposed pregnancies. So really a long way from the old fetus-centric and moral shaming ways of preventing FASD to really joining this century in lots of ways. And this zany Facebook approach from New Zealand, I think, is just another excellent example that focuses on women's friendship as a support to not drink after unprotected sex and binge drinking while you're in that 6-week or whatever period it is before you know you're pregnant. And can get a test. So really thinking about reducing harms and empowering women as a whole new way of preventing FASD. And like your bystander initiatives in the violence field, there's some action on really engaging men in supporting women's health and preventing substance-related harms. And some just remarkable work from Indigenous women's organizations, thinking about how to do culturally safe, equity-oriented work on substance use issues in communities that build on dream catcher models, that build on the seasonal way of looking at growth and change, that use language, the learning of language as a strengths-based approach to centering yourself in your culture as opposed to in your substance use. This is remarkable work that's captured in this, small pamphlet. And I've been working with Dr. Deb Rutman and Carol Hubbersty and Marilyn Van Bibber over the past few years on this co-creating evidence project with 8 programs across Canada who are using a wraparound model to address substance use in pregnancy, supporting women to enter these services and get what they need at the pace they're ready for, in the order that they're ready for, etc. And this is just a picture of some of the things that women said that they engaged with when they went to services like these. Some examples of these services in the Vancouver area are She Way and Maxine Wright, etc., and Her Way Home in Victoria, etc. So really thinking about how do we start where women are at? How do we make substance use and trauma and violence support a part of what they can choose to do and get support on, should they see that as important, and allowing them to work on housing and child custody and other issues first, rather than seeing that substance use has to be the first place to begin. We got some funding from Health Canada to do a bit of work around thinking about how could collaboration happen between the child welfare and the substance use field as a collaborative effort. And I just thought it was a bit inspiring for how we might work also across the violence and substance use field. So in this project around mothering and opioids, we actually mapped out, what is the work of substance use people in supporting recovery, and what is this work of child welfare to support families to be together and the children safe, etc. And then what's the shared work on supporting attachment and parenting and supporting the material and social needs of women, and coming at it through approaches that about mother-child togetherness, about harm reduction, about holistic, and about, most importantly, optimistic and appreciative approaches. So really starting to think about, there's so much more we can do. I just wanted to mention this rather older piece of collaboration I evaluated with the Victoria Sexual Assault Center a few years ago. This work they did where they adapted the seeking safety model and co-delivered some sessions by a substance use counselor and sexual assault, violence against women counselor. And they did it in a really great way, a trauma-informed way, where they encouraged women to drop in for 3 sessions to learn some coping strategies before they made a decision to join a group. So just giving them the chance to connect on any day, just start where you are, just don't be high when you come in to the sessions. And then having a seeking understanding group based on the seeking safety model by Dr. Lisa Najovitz in the US. They made it a 12-session group. There's many more sessions in the seeking safety model, but they also broke it down again to create choice and success by having a choice point after 6 sessions. So you could do the 3 sessions, drop in and choose to do the group or not. You could do 6 sessions and then choose to do the second 6 sessions or not. But of course, what we found was that women got what they needed and they appreciated it, and no one didn't finish treatment because they finished what they were ready for and able to do. So I just want to go down the trauma-informed piece just for a minute or two as we head towards the end of the presentation. And again, recognize that the work on trauma-informed practice really arises from this idea of linking across fields. Those of us who are feminists brought feminist theory and practice to it, but Indigenous women, the public health research on the adverse childhood experiences, and the work on neurobiology and clinical research really helped us see how important it was to use trauma as a paradigm and to think about how many of the responses to trauma we all see in our different places, and whether those are things in the spiritual area like guilt and shame and self-blame, or whether it's in the emotional area like depression and irritability and difficulty forming relationships, or whether it's in the behavioral area around self-harm and hypervigilance and isolation, etc., whether it's about the physical area around pain or the cognitive area of the difficulty making decisions and inability to concentrate. We all see these in the course of our many different locations, in schools, in first responders, in substance use services and violence services, etc. And really important for us to connect up the ideas and work from these trauma-informed practice principles of creating choice and safety and strengths and skills in the way we come to the work. And, great folks have also from the violence field have really picked up some of this work and named how important it is to be both at the client level and at the organizational level. And Colleen Varco and Nadine Waffen and many others I've worked with who've, come together to form this great infographics like this, and working with the primary healthcare system and with violence services to really think about how can these trauma-informed principles be woven in there. And, most importantly, I wanted to make the point for you as worker wellness, how important it is for your resilience to be able to be well in this context. And I know you're going to have the chance to talk with the fabulous Vicki Reynolds tomorrow. And her work has been so great, the more traditional self-care approach in the center and an Indigenous approach from some of the work I've done in Western Australia, where some of the Indigenous women there have actually created their own culturally based mindfulness app. So just really important for us to be thinking about how important it is for you to be well and resilient and have the opportunity to build on that in the context of your organizations. This is an example from the child welfare field. We're really emphasizing at the center that they're not only about child well-being, they're also about family well-being and the well-being and resilience of those working in the system. And that's what I think so fundamentally important about trauma-informed approaches. You in the violence field have been thinking lots about being trauma-informed at the, collective level. And here's a couple of examples that I've been really inspired by from the Pennsylvania Coalition Against Rape around trauma-informed supervision, and from the Missouri Coalition Against Domestic and Sexual Violence on how the earth didn't fly into the sun. I just love the title of that. The title's better than the content in some ways, but really trying to think about ways of reducing rules and rigidity and instead working in a much safer and collaborative way. Lots of great work is being done on seeing this collaborative work as being about, supporting the connections with our clients and among staff and among agencies, and building on relationship-based theoretical frameworks. Amazing group, Breaking the Cycle, and the Mothercraft group in Toronto, done absolutely amazing work on linking violence and substance use and many other issues for child mental health and women's health as well. So to sum up, really trauma-informed, I think, really guides us in being able to do the collaborative work across systems. And I just wanted to end with this idea of solidarity. I started with our recent research on pandemics and making visible the increases in substance use and violence and their connections, and how it reinforces how we need to work together, doing anti-violence work and those doing substance use work, because the issues are connected. We need to understand the common roots of both issues in trauma and gender inequity, and provide, at the very least, coordinated, if not co-located or integrated services that reduce stigma and suffering that's attached to both issues by delivering on the approaches in the image here. I've hoped I've helped you see some of the newer work of the substance use field that helps you have respect for its advances and complexity, and how these principles and practices that are guiding your work are also being enacted by feminists in the substance use field. I've touched on agency level work on trauma-informed approaches that hopefully helps you see the importance of your wellness and resilience that's supported by your agency, so that work with substance users and service users of all kinds can be both authentic and actually lightened by working in that way. And I've tried to describe the possibilities in all this work in a way that shows you it need not be additive to your burdens. It's about solidarity, returning to the benefits of consciousness raising, where we share our experiences together, we connect across difference, we synthesize to create understanding and reduce ignorance, versus telling each other what to do, leading to collective action. In other words, it's about lifting each other up. Thanks.
Thanks, Nancy, for a great presentation. There's a number of questions in the chat. A number of people have requested your resources, so which will sort of be in touch with you about your PowerPoint and any other resources you want to share, and we'll have those uploaded for everyone to access after the ATF. So there's a few different questions. One of them is someone's asking, is there any work being done on upstream approaches that are focused on men in particular?
Absolutely. Really, the violence field has been doing this better, but I do feel that there are, glimmers of beginning to see the importance of gender-specific approaches for women, for men, and for gender-diverse people in the substance use field. And I think, that idea of the binary being blown open has really helped that a lot. For years, we've tried to say, I may be interested in violence against women and women's substance use issues, but you need to think about the men's side of it as well. And I think that trauma-informed has helped us in that using that as a foundation to see how important it is that we work from that approach in all that we do. And so we are starting to see a bit more work for and with men, and for and with women, and for and with gender diverse folks in the substance use field. Lots of ways to go in that. And one of my things here, if I can just grab it, has really tried to look at that from the point of view of fusing trauma and substance use issues. And it's on my website called New Terrain, Tools to Integrate Trauma and Gender-Informed Approaches into Substance Use Practice and Policy. And there's whole sections on the men side of it within that, as well as gender diverse and women's pieces. Sorry to go digging in my...
that's a very handy thing about being at home, right? You can just grab some resources, right? So there's a question, Nancy, that's kind of related, I think, to just a little bit of what you were just answering the last question. It's, was there information that came up in your research related to trans and gender-diverse experiences of the links between substance use, gender, and violence?
Not very much, unfortunately, but I think, the world is starting to open up to the importance of thinking about all these issues together. And as I mentioned, there's a bit in the new terrain, what we could find in that project. And there's a bit more in this work that we have tried to do on integrating sex and gender informed evidence into your practices for the substance use field. And we've really tried everywhere we can to name what is there and to walk with. And I think it's another great example of solidarity, right? That really the work that we've done on girls and women's substance use allows us to, reach out and walk forward with those who are really trying to think through what makes the challenges similar and needing different attentions as well. And one of the big challenges in the substance use field is that you're actually putting substances in bodies, and therefore it affects hormones, it affects all kinds of different aspects of biology as you're doing that. And of course, for gender diverse folks who may be transitioning, that complicates the response to substances. And we have so much to learn about the sex side of it, as well as the gender side of responding well to gender diverse people with substance use concerns.
Yeah, thanks so much, Nancy. Another question that's come in is, can you speak more about supportive mother-child models for mothers who are addressing opioid use, specifically with regard to cohabitation? So I assume they're with their children or hoping to be with their children.
Yeah, there is a lot of work being done to think through how can that work really be achieved, and how we can really think about how we can wrap care around the mother-child unit, and to think about how we support attachment specifically. And attachment may be a particularly hard thing for women who have histories of violence and trauma and substance use. And so it's not something that may come easily there. And that's why I think the work that I mentioned of all the co-creating evidence project folks, and the work we did around the mothering and opioids. When we went into the literature on responses to the opioid crisis and mothering and opioids, we found really quite a number of programs that were trying to think about how do, like Circle of Security, many others. I've got a whole hour presentation on all those different programs that I'm happy to share with people if they want to have a look at it. But that I think is extremely important for us to think about at this point, is how do we, since we're changing the birth alert issue, since we're changing the just taking you use, you lose kind of thing, apprehending children, how do we really helpfully provide support to mothers and to children and to all the connected families around them, if they still have those families, that really does support living together and growing together in ways that are safe for both. And it's a huge topic. I'd love to talk to whoever raised that question, because I think it's really a really important question.
Yeah, thanks, Nancy. I'm sure they'll be reaching out to connect with you more about that. So there's two more questions. One of them is regarding seeking safety. Can you elaborate on why you think the breaking up the sessions was successful? And if they were adapting their program curriculum, what would be good coping strategies to focus on for those first 3 sessions?
Yes, well, seeking safety has a ton of stuff in it, as people may know. It's got many, many sessions. They did adapt it. And you know how they did it in a really trauma-informed way was they sat down with women and went through the topics and said, what are those topics that most appeal to you as a place to start? And women chose what topics they wanted to begin with. So it was already, you could see, reparative of the shaming and the harms and the power over kind of thing by saying, hey, help us pick what might make sense to begin with. And I think the choice points are extremely important, because so often it's hard when you're doing something that's a bit more trauma specific, because this is actually going into trauma, where trauma-informed approaches are simply creating safe environments that don't necessarily force disclosure. But in this case, these were women who did have these issues and wanted to look at it a bit more closely together. And I think it makes a huge difference that you can be in that place of saying, after 6, that I've got enough for now. And if you look at the evaluation, many of the women said, thank you. I just want to practice some of the stuff I learned in these 6 sessions, and I can't really take in anymore right now. And I'm just going to be overwhelmed if I do. And so you can see how trauma-informed that is, of just letting people get what they need and practice skills and carry on forward from that, rather than forcing them. This is a 12-week program, you're going to do that, or you're going to be an incompleter and MCFD is going to be on your case, or whatever, right? So I think the choice point was extremely important and continues to be. Actually, quite a few of the women, I forget how many now, so many years ago now, but quite a few of the women said, thank you for those 3 sessions. Like, you know what? I got more of those than I did for time with my shrink for, and I don't want your effing group, right? So I just think it's kind of neat that, you eliminate your wait list by being helpful, and women saying, thanks, see you later, Okay, to come to the point of what was in the groups, the first part of it, I'm not exactly sure all that they offered there, but I can see all the elements of self-regulation of what, I know that's a sort of clinical term, but helping people center, learn different kinds of grounding, learn what works for them, really get a bit of a chance to practice different things and recognize that not everything that mindfulness may not work for you, even though it has evidence overall. Or maybe you can practice from 3 or 4 different mindfulness apps till you find one that does fit for you. So I just think that, ask the women about what's helpful. Try lots of things. And the thing on that slide that I had about seeking safety, I had a picture of a handout that Lisa Najovitz made of safe coping skills. I think there's 83 of them on the page, and she also has them in the Seeking Safety book. And she encourages people to photocopy them. And if you don't want to order the pretty pictures of it, it also comes as a big poster on the wall if you want to just have it as in your offices as ideas about what might be a good coping strategy for you. But while we're on the topic of Lisa Najovitz, I just wanted to mention one of her more recent books, which is may be helpful for some of the women you work with. It's for literate women or men or gender diverse people that she addresses it all, about called Finding Your Best Self, recovery from addiction, trauma, or both. And it gives some great tools for thinking through, what may work for you. And again, in the center, it's got that same safe coping skills list of many, many safe coping skills that really encourages people. So if that didn't work, try this week, try a different one. There's 84 of them or whatever, there's not everything is the same for everyone, and you need to find what works for you. And I remember when we first started to think about being calm and learning grounding and whatever, I thought you had to lay on the beach kind of thing. Imagine laying on the beach and all that stuff, which was so not me as a speedy person. But I found later I could do that. But to start with, I found it was really helpful for me to think about mental grounding of, reciting the Blue Jays players, from outfield back to catcher, and really use that as a way of taking a moment to take my mind off of what was taking me away from myself, and using that as a form of mental grounding. And so people have to find what works for them, and there are so many.
Yeah, thanks, Nancy. More resources for all of us, which is always neat. So just one more question, Nancy. So again, a few comments. I just love the framing of lifting each other up. Obviously, that's a beautiful metaphor, I think, for much of the work we all try and do day to day. It seems like the foundational pieces of foreground for intimate partner violence, the person just wanting you to comment on familial violence and the impact of immigration and diverse linguistic constituent in service delivery, I believe, for substance use services, because we know all of those intersections have impacts on the way programs are developed, who's able to access them, and how they're created as well.
Huge, important piece. And Ninu may be the best person to answer that from her many years of working at Mosaic and building liaison between the immigrant services and the substance use field as well. She may be much better able to answer that than I am. But I just want to underline how critical and important those being culturally safe is. And, it was interesting when I was doing this book. God, this is becoming a tour of my office here. When I was doing this book on becoming trauma-informed, I worked with an immigrant women's health center in Toronto to try and define what trauma-informed was for them. And it was interesting that they said, a lot of the people who are immigrants and refugees and others who are coming from different cultural places, they don't actually want to use the T word, the trauma word. They actually want to get on with trying to find balance in their lives and have work and be safe. And I just thought it was a really good lesson for me around trying to think about how you have to kind of separate out people of different cultures instead of pulling them into the common work on determinants of health. And I don't know whether that's helpful as an answer, but it really made me think. Yeah.
Yeah, thank you, Nancy. Thanks so much for your presentation. And yeah, I know many people are probably interested with many of the resources that Nancy has shared today. So we'll kind of keep our eye on those and kind of put them in the kind of information for the ATF Hub. And thanks again, Nancy, for your really thoughtful discussion about trauma-informed practice and the intersections between mental health, substance use, and gender-based violence. So again, I think for both Nancy and Chief Kashmir from this morning, there's about 1,000 hands clapping for both today because there's many people out in the Zoom room. So that brings our morning sessions to a close, everyone. So if you'd like to connect with other participants over the lunch hour, you can do this through the community tab on the training forum website. You will be able to join a virtual lunch by clicking on discussions or directly messaging others through the attendee section. We will begin workshops again at 1 p.m. So we hope everyone has a wonderful lunch breaks and gets a chance to rest and relax a little bit. And again, thanks so much to Nancy and Chief Casimir for their both amazing presentations this morning. It was really an honor to learn from both of you. We'll see everyone back at 1.